hemorrhagic tracheitis. You can see here in this box the removed part of trachea obtained from patient with the influenza. We can see swelling of the mucosa and pinpoint hemorrhages on the surface of the trachea because of desquamation of epithelium and engorgement of the vessels. Please remember, cytotoxic effect is a typical effect of proliferating influenza viruses and the dead epithelium cells. The desquamation of epithelium is a very important marker of this disease. Sometimes we can see this in areas of necrosis in trachea, in bronchi, and in lung tissue too. Also, influenza viruses can cause the extravasation of blood, increased permeability of the vessels in the walls of the trachea and of the bronchi. Firstly, please describe the gross tracheitis in influenza, and then I will show you the changes in the lung in this disease. So, tracheitis, fibrinous hemorrhagic tracheitis in influenza. So, films we can see thin, grayish-colored threads covering the mucosa of trachea, fibrinous component. Also, we can find pinpoint small hemorrhages in the same region. So, color of trachea is grayish red because of hemorrhages and fibrin accumulation. These films are loosely attached to the underlying mucosa. This type of inflammation, hope you remember, is called membranous inflammation, and mucosa is swollen and reddish. In newborn children and small children, the edema of the mucosa can cause asphyxia sometimes. Adhesions, they are loosely attached to the underlying mucosa. But these changes are not so important for patient and also dangerous, and opposite to the pneumonia. Pneumonia in influenza is characterized by the alternation of different pathological foci in the lung parenchyma. We can see areas of necrosis, hemorrhages, atelectasis, superimposed bacterial infection, and that's why areas of suppurative inflammation, foci of bronchopneumonia, and nearby this foci we also can find perifocal emphysema. That's why on cut section this lung in influenza, in complicated form of influenza, is called large multicolored lung because of alternation of this foci. Areas of necrosis and atelectasis are connected with the cytotoxic effect of the viruses. Immune suppressive effect leads to the bacterial superinfection, and also increased permeability of the vessel leads to the hemorrhages, hemorrhagic component. So slide 188. So on this slide, by the way, we can see the inflammation of wall of bronchus and gorged vessels and extravasation of the blood. So point number 1, inflammation in bronchial wall, inflammation in bronchial wall. So point number 2, exudate in adjacent lung parenchyma, exudate in adjacent lung parenchyma. Point number 3, focus of pneumonia. Point number 3, focus of pneumonia. Point number 4, hemorrhage. 5, atelectatic focus or atelectasis. Point number 6, area of necrosis. And point number 7, perifocal emphysema. Perifocal emphysema. Hope you remember the figurative name of this lung according to the gross inspection, gross appearance. Large multicolored lung. By the way, influenza is included in your exam cards. So a few words about the measles and pneumonia in measles. Today we will discuss also the complicated form of this viral infection. Please remember, in measles we always can find immune suppressive conditions and also activation of the bacteria, bacterial superinfection. Severe destructive bronchitis and bronchiolitis in measles always leads to the bronchopneumonia development. According to the distribution of this inflammatory foci, we always can find polysegmental pneumonia with the affection of multiple segments in the lung, sometimes in both lungs. Also, we will see destruction of bronchi and bronchioli with following bronchiectasis formation. Grossly, we can see classical yellowish colored round fossa in the parenchyma of the lung. Bronchopneumonia, we discussed these changes earlier. You can see on cut section in lower lobe of the lung multiple round yellowish color foci. They are firm. And in central parts of this foci, we can see transected bronchi or bronchioli filled with the pus. Please remember, destructive bronchiolitis or bronchitis is a background change for this pneumonia development. So peribronchial pneumonia in measles, lung appearance. So please miss this point. So foci, multiple. The first point was localization. So in lower lobes of both lungs, number multiple. In lower lobes of both lungs, number multiple, sizes are small, few millimeters in diameter, color grayish, sometimes yellowish, shapes round, consistency is firm.
Shape is brown.
Brown.
Brown, yeah.
Consistency firm.
Brown. Shape is
For
brown.
several milliliters.
Guys, I speak with Masha and she called to our PE teacher. She said that next week she's going to sign at 2 o'clock our case.
Next week.
She called the teacher and here I go to see the crying for the credit.
Can she just like give us the link to the shit on the teaching?